Are you struggling with nerve pain that just won't go away? You've probably heard about pregabalin, but there's a newer drug called Mirogabalin that's changing the game. Today, I'm breaking down 7 key differences between these two medications. And trust me, difference number 5 will surprise you. Let's keep this simple and clear so you can understand exactly what sets them apart. So, what exactly are Mirogabalin and Pregabalin? Both of these drugs are used to treat nerve pain, also called neuropathic pain. They belong to the same family of medications called Gabapentinoids. But here's the thing, just because they're in the same family doesn't mean they work the same way. Think of them like two brothers who look similar but have very different personalities. This comparison matters because if you or someone you love suffers from nerve pain, understanding these differences could help you have a better conversation with your doctor. Whether you're currently taking pregabalin, considering starting it, or just curious about newer options, this video is for you. So let's dive into the 7 key differences that you need to know. Difference number 1, how they bind to nerves. Let's talk about how these drugs actually work in your body. Both Mirogabalin and Pregabalin attach to calcium channels in your nerves. But here's where it gets interesting. Mirogabalin binds 17 times more powerfully than Pregabalin. Yes, you heard that right, 17 times stronger. And it doesn't just bind stronger, it stays attached much longer too. Mirogabalin holds on for about 11 hours, while Pregabalin only lasts 1.4 hours. Think of it like this. Imagine a lock and key. Pregabalin is like a key that opens the lock but falls out quickly. Mirogabalin is like a key that locks in tight and stays there for hours. This longer binding time means more consistent pain relief throughout the day. Difference number 2, selectivity, where they work now. This is where things get really fascinating. Pregabalin is like a shotgun, it hits everything. It binds everywhere in your nervous system without being picky. But Mirogabalin, it's like a sniper rifle, precise and targeted. Your body has 2 types of binding sites called alpha 2 delta 1 and alpha 2 delta 2. The first one, alpha 2 delta 1, is found in your dorsal root ganglion, that's where pain relief happens. The second one, alpha 2 delta 2, is in your cerebellum and brain, that's where side effects come from. Here's the shocking part. Mirogabalin stays attached to the pain relief site for a long time but leaves the side effect site quickly. Pregabalin stays on both sites for the same amount of time. The result? You get better pain relief with fewer brain-related side effects. It's like getting all the benefits with less baggage. Difference number 3, speed of action. Let's talk speed. When you're in pain, every minute counts, right? Mirogabalin reaches its peak concentration in your blood in under 1 hour. Pregabalin takes about 1 hour. And if you've heard of gabapentin, that one takes 3 whole hours. Mirogabalin is the fastest of them all. But here's what really matters. Patients taking Mirogabalin report pain relief starting in just 2 days. 2 days. Compare that to waiting weeks for other medications to kick in. When you're living with nerve pain, those extra days of suffering really matter. Faster relief means you can get back to living your life sooner. You can sleep better, work better, and enjoy time with your family without constant pain holding you back. Difference number 4, dosing less is more. Here's something that will blow your mind. Mirogabalin needs much lower doses to work. How much lower? Listen to this, just 30 milligrams of Mirogabalin equals 600 milligrams of Pregabalin. That's 20 times less medicine. Let that sink in. You're putting 20 times less medication into your body to get the same result. When you start Mirogabalin, you typically begin with just 5 milligrams twice a day. With Pregabalin, you're starting at 25 to 150 milligrams. The maximum dose of Mirogabalin is only 30 milligrams per day, while Pregabalin can go up to 600 milligrams. Why does this matter? Lower doses mean your body handles it better. Your liver and kidneys don't have to work as hard. This is especially important if you have kidney problems. Less medicine, same relief. That's the dream, isn't it? Difference number 5, side effects. Alright, this is the one I promised would surprise you. Every medication has side effects, we all know that. Both drugs can cause dizziness, drowsiness, weight gain, and swelling. But the numbers tell a shocking story. In studies, only 7 to 19% of people taking Mirogabalin felt drowsy. With Pregabalin, a whopping 47%. That's nearly half of all patients feeling sleepy. For dizziness, Mirogabalin caused it in 6 to 13% of patients. Pregabalin, 19%. Why such a big difference? Remember that selective binding we talked about earlier? Because Mirogabalin doesn't stick around in your brain areas as long, you get fewer brain-related side effects. And here's the real kicker: fewer people stop taking Mirogabalin because of side effects. Better tolerance means you can actually stick with your treatment and get the results you need. What good is a medication if you can't tolerate taking it? Difference number 6: effectiveness in studies. Let's look at what the science actually says. Both drugs work for nerve pain, that's proven. But when researchers put them head-to-head, something interesting happened. Mirogabalin showed superior pain reduction compared to Pregabalin. In one study, just 30 milligrams of Mirogabalin beat 300 milligrams of Pregabalin. Remember, that's 10 times less medicine working better. Patients' pain scores dropped more significantly with Mirogabalin. But it wasn't just about numbers on a chart. Patients reported better quality of life. They could do more. They felt better. And in long-term studies lasting 52 weeks, the benefits lasted. Over 80% of patients stuck with Mirogabalin for the entire year-long study. That tells you something important when a medication works and doesn't make you feel terrible. People keep taking it. And consistent treatment is what leads to real, lasting relief. Difference number 7: availability and approval. Now here's the frustrating part. Pregabalin is available almost everywhere around the world. It's FDA approved and your doctor can prescribe it today. But Mirogabalin, that's a different story. Right now, it's only approved in Japan, where it launched in 2019, South Korea, Taiwan, and some parts of Asia. If you're in the United States or Europe, you can't get it yet. It hasn't received FDA approval. Why? These things take time. Drug approval is a long, expensive process. The company has to submit data, run trials, and wait for regulatory review. So, what does this mean for you? Well, it depends on where you live. If you're in Asia, you might be able to ask your doctor about it. If you're in the US or Europe, you'll have to wait. But the future looks promising. As more countries see the benefits, approval may come. For now, talk to your doctor about what options are actually available where you live. Let's quickly recap those 7 key differences. Number 1, Mirogabalin binds 17 times stronger and stays attached 11 hours versus 1.4 hours. Number 2, it's selective, targeting pain relief while avoiding side effect areas. Number 3, it works faster, reaching peak levels in under an hour. Number 4, you need 20 times less medication for the same effect. Number 5, it causes significantly fewer side effects like drowsiness and dizziness. Number 6, studies show it's more effective at reducing pain. And number 7, it's not yet available everywhere. So which one is better? Honestly, it depends. It depends on where you live and how your body responds. Mirogabalin definitely shows promise as the next generation of nerve pain treatment. But here's what's most important: always consult your doctor. Every patient is different. What works for someone else might not work for you. And never ever switch medications without medical advice. Your health is too important to gamble with. Thank you so much for watching this video. If you found this information helpful, please hit that like button and subscribe to the channel for more health content like this. I'd love to hear from you in the comments. Which drug have you tried? What was your experience? Your stories help others who are going through the same struggle. If you want to learn more about nerve pain treatments, check out the videos I'm recommending on screen right now. One last reminder: this video is for educational purposes only. It's not medical advice. Always talk to your healthcare provider before making any decisions about your medications. Thanks again, and I'll see you in the next video.